Howdy friends, I'm Seth Sumner, your city manager, and it is Tuesday, April 28th, 2020. I'm here again for our 44th day with your daily COVID-19 update. Now today with the Tennessee Department of Health's data, they have included an easier way to look at some of their information on the starter page, and I just wanted to show that to you before we do a little bit deeper dive into what their data is showing today across Tennessee and here in Athens. So here we have, if I can move that dashboard out of the way, here we have 10,052 cases now across Tennessee, and this is doing the easy math for you. What some of us have built out spreadsheets to try to keep up with, they're now showing us some of this easy math. That is an additional 134 Tennesseans who have been identified as COVID positive since yesterday at 3 p.m. The good number that we're happy to celebrate with you is an ever-growing one. We're happy to see this is 4,921 Tennesseans that have fully recovered. And we do understand that recovery is based on a lapse in time from when they were first diagnosed, and then they have not turned up on the terrible number that we don't like to harp on too much, but we have to know is real for a lot of Tennesseans, is they're not deceased. And so that number is here. That's 201 Tennesseans who have fully recovered from COVID at this point. And 201 is, of course, greater than 134 new cases. So we want to continue to see a larger and larger difference in those numbers. We have added 4 Tennesseans to our death toll now since yesterday. 188 of our friends, our family, our neighbors have died from complications due to this novel coronavirus. We do not like to see this number go up. We did know starting out that that was likely to be a much, much higher number. Of course, we're not through this. COVID-19 is still going to be a threat to your health and my health and everyone's health. We do know that our vulnerable population, those who with weakened immune systems, our seniors and elderly, mothers, newborn, folks that are in vulnerable situations, are more heavily affected by the novel coronavirus than our healthy population. And what we do know about that is 1 in 3 elderly are dying if they catch COVID. 1 in 4 seniors die if they catch COVID. And then if you get down to the largest affected population range, 21 to 30, I haven't checked the number today, but through just a couple of days ago, there was only 1 death in that otherwise healthy population. And so it is those vulnerable people. That's why it's important for us to use proper hygiene, to continue socially distancing ourselves from others, to use face masks, and also eye coverings. If you don't wear glasses, you may want to consider, if they're available, finding some goggles to wear if you must go out into public. I know you need to go get groceries. You need to go and do some essential shopping for some essential items just to maintain your household. Make sure that you're taking those precautions so that, 1, you don't get COVID if it is present where you're going, and 2, you may be asymptomatic. If you have not been tested, you may not be showing symptoms. You may be carrying it and not knowing, and those materials will help you not spread COVID to other people. And that is very important as we continue to try to keep this pandemic from spreading even further than it has. There's a couple other numbers I want to share on this initial page. Hospitalizations, we knew that our hospitalizations may be a factor that we may be wearing on our resources at some point in this pandemic. We're hoping we're past that surge. We're hoping that. And we know that we only had 7,812 hospital beds available across the entire state of Tennessee. And that was likely that we would need more. There was an addition of 7,000 beds to our system early on, and thankfully we never got close to maximizing our use of those resources, our need for those beds. We have had 881 out of the total 10,000 cases. 10,000 cases, 881 have needed hospitalization. They've needed to be in ICU, they've needed ventilators to help them recover from their symptoms. And so there are obviously a lot more beds available still, and we hope we don't have to use them. But this is a much better picture than we were initially being told by some good, relatively accurate data that was predicting those models for us to use to know what we might be up against. And we never got close to needing those. That's a good thing, and I hope that stays. 161,926 Tennesseans have been tested. The governor and the Department of Health and primary care physicians have got serious about testing. We've ramped up the number of tests that we have available to help test the population. Our state officials and private partners are working on an antibody test. We want to make sure that that is going to be accurate enough to be used to show us good data, and so we are looking in the days ahead of being able to roll out that antibody test and be able to test for that history. There's some good explanation of that on tn.gov. If you go and look under the COVID-19 tab, there's a lot of good information there, and it will tell you all about the prospects of the antibody test and what we're looking at being able to tell from that. I know that's been a big discussion among you. 160, just shy of 162,000 tested. That's incredible. We've got really aggressive with that. And I'll use this opportunity again to tell you that even if you aren't showing symptoms, I did see that Governor Bill Lee made a statement, when in doubt, get tested. There's a possibility that we're carrying it and we don't have the symptoms. Go get tested. If you want the test, it is available. It is free. There's no cost, no lab cost, no cost whatsoever. It's a drive-through test. You do not get out of your vehicle. It is at the Tennessee Department of Health, here locally in McMinn County, and there are also other assessment centers that you can find on tn.gov that you may be able to travel to if you're not able to make it to the local center. You may also be able to use your primary care physician to obtain a test. Call your primary care physician first if you're interested, and then make a call to the Tennessee Department of Health, and that way we can put you in contact and know where you're going, who you need to see, and make that drive-through test if at all possible. That is an increase of 7,526 tests from yesterday. We hope to continue seeing those tests, excuse me folks, seeing those tests increase. So let's go to our state data. We know, as we've talked about for 44 days now, that Shelby County and Davidson County are the hardest hit areas of our state. And you can certainly see the metro area has been hit hard too. We've got Hamilton County showing 149 COVID positive persons. And then we have, I believe that's Bledsoe County right there, if I can remember my geography. 589 cases. And what we're looking at, why is that so much different? Bledsoe is not a huge population. Why is that different? It's because there are prisons there. There are incarcerated persons, and they have all been tested, and that is showing that somehow that was allowed, not allowed, but COVID-19 has been in those facilities and has spread, unfortunately. But that's why that is such a different number for our otherwise low numbers in our rural area. Now, here we are at McMinn County. We were at 65 yesterday, 70 today. We have an additional 5 cases that have been identified here in McMinn County. We're sitting at 70. We do know that the vast majority of those cases that caused that huge spike yesterday, those 51 new cases yesterday, is coming from a cluster at one long-term care facility. The Department of Health, as well as that private facility and their corporate, have been working hand in hand for several days now to make sure that they are mitigating further spread of COVID-19 in that facility. They have separated the well residents from the COVID positive persons. They are isolating those populations within the facility. Families are not allowed to go there right now, but they are making sure that they've got their population tested. They're going above and beyond regulations as far as how deep they clean and how often they clean, and cleaning every shift, and making sure that they keep all surfaces clean. That's important in our homes, in our businesses, and especially in those type of facilities. Above and beyond what they would normally be doing in these circumstances, they are taking care of that, and our thoughts and prayers remain with those residents and those healthcare workers that are infected right now. We want to lift them up. We pray for their recovery. We want to make sure that they're able to get over this and that their families can visit those residents. I know that means the world to them, and I just can't say enough about how much this affects our entire community and how much our thoughts remain with you, the families and the persons that are affected by this right now. And I did call the facility. I talked to management out there today to let them know the city of Athens is here. We are here. If they need anything, they can call on us. We'll do what we can to help them in their situation. I also notified them of what to expect if they need police or fire. If our first responders have to go to this facility, how they will be met. I showed you a picture yesterday on the video of the full Tyvek suit, sans gloves, but otherwise the full Tyvek suit that we will have one of our firefighters dressed at, whether it's a police or fire call, that will respond to that facility or anywhere else that we know that there are COVID positive persons. And we'll make contact with someone at that site, and they'll be able to relay the information either to police personnel or other fire personnel to know what the response is needed at that time. And they'll either be able to suit up also in Tyvek to protect themselves as well as the health of others, or if other response is needed. We'll be able to know that, but we're taking all precautions with public health, and especially our first responders during this time. So we see that one long-term care facility, you can't say it too fast, long-term care facility that has caused the biggest increase in McMinn County. And other than that, what we do know is that our population that is being tested is testing negative. It's testing negative. It's been really rare, and I know you've been keeping up for the last 44 days. It has been absolutely rare for us to have an increase, and if we have an increase, it's 1 or 2. I think this has got some folks worried and scared, but we do understand that this is an isolated event at a facility. This is a cluster, and that our Department of Health and that private company are working hand in hand to make sure that they get a grasp on that, and that they're able to get the necessary response to those COVID positive persons to help them recover as best can. So we'll scroll down. We've talked about 10,052 total cases, now 188 deaths. And we can see again the data trailing off. We will be a few more days from getting complete data to know what this actually looks like. It looks like a flat line to us right now, but we don't know what it will look like in 2 or 3 days. We have to wait to get this data to see what that really looks like. We have not had a flat line yet. We were hoping and expecting. We reported on a flat line several days ago, but as you can see, those cases continue to grow, and they will because we are testing more and more. The more you test, the more you know of the actual results, positive or negative, and where there are positives, they will be reported here. To get my scroller working again, 49% of cases are fully recovered at this point. Still 2% death rate in the state of Tennessee for COVID positive, and tested just shy of 162,000 people. I want to show you a little bit of another way to look at this data. When we look at, if I can get the right here. All right, so here's McMinn County on this line right here. You can see we're still at 4 fully recovered, 70 COVID positive, 1,080 tests. 1,080 tests for our roughly 55,000 population county, which is a tremendous effort by our health department and our primary care physicians, our hospital, all working together to make sure that we're testing. We continue to test at a higher rate than many of our neighbors. And outside of this one identified cluster that shot our numbers way up over the last couple of days, we're knowing that our population is not infected, is not spreading. And so this is important to recognize what lies within these numbers and what's the story behind the numbers. The biggest plus for us is that testing. And that's important because what I want to show you, we know we're at roughly 55,000 people here in McMinn County, and we think about how large an area Hamilton County is. A much, statistically much larger county population-wise than McMinn County. And here is Hamilton County. They have 13, I'm sorry, those are deaths. We have 0 deaths. That's a good, happy number for us, and we hope that maintains. But Hamilton County, they've had 84, I'm sorry, I'm going to have to go back up. 84 recovered, 149 positive, but 1,926 tests. So when you think about Hamilton County's population and McMinn County's population and the number of tests, they're at 1,900 and we're at over 1,000. We've already conducted over half as many tests as Hamilton County. And that's what we keep talking about. Get out there and get tested. It's working, it's showing good data, and we have to know whether folks are positive or negative. And so this is what I keep talking about, that 1,080 tests. We're testing at a higher rate than most counties in the state of Tennessee, and that's thanks to you getting out there, being proactive, and wanting to know. Wanting to know so that you can take care of your health and protect the health of your family and loved ones, and all people. So I'll end the look into the Tennessee Department of Health's data there. I do have a special guest with me today. If you'll want to come up to the table, we'll go ahead and get set while we move the camera around. All right. And typically, under normal circumstances, we would shake and greet each other, but
we're not doing that anymore.
We are not doing that anymore. So I would like to welcome Dr. Harley Knowles, who is president of Tennessee Wesleyan University, to the Daily Update. It is wonderful to be with you. You are president of Tennessee Wesleyan, who has had a footprint here in Athens for 100 and, do you know off the top of your head?
We're approaching 160 years.
Yeah. 160 years in some fashion.
Yeah.
Right in the heart of downtown Athens. And so we know that there's a tremendous impact on higher education right now with COVID-19. But just want to say thank you for taking time to be with us today. And I thought this would be a good opportunity to share a little bit of the story of how that higher education, how our local university is being affected. And for anybody that may be watching that might not be familiar, would you mind telling us, just open up telling us about Tennessee Wesleyan?
Yeah, I really appreciate it. Thank you for letting me be a part of this, Seth. We're eager to be a part of the solution and help. And we're a university of 1,100 students. We have graduate programs and undergraduate. 70%, 80% of our students are from the surrounding counties, but we also draw students from all over the world, mainly our athletes. We have about 350 student athletes, and we have about 250 employees, both part-time and full-time, many of which live right here or in adjacent counties. So very much affected by all this. And this has been a really challenging time, there's no question, in higher education. Many of us got in this business because we like spending time with students, making a difference in their lives, mentoring, teaching, and to have them remote from our campus and not with us has been really challenging, really has. But we're coping. We've made a bunch of changes, and we will come out of this stronger and better. And really appreciate the way the community. Just one little quick story, if you don't mind.
Sure.
One of the things that we have about 100 students that are staying in our residence halls. We kept our residence halls open. We kept our dining hall open. We're down to just a restaurant open now. But many of our students want to stay here in this community because this is kind of their home now, even though they might have been away. We put out the call that some of our students needed some care packages, and churches and all kinds of wonderful people dropped off care packages for these students, and it's just really wonderful. And some of these students are from New Zealand and England and all kinds of places. So just a lot of positive stories out of what is a really challenging situation.
That's beautiful, and we've talked about that that spirit of Athens, spirit of the friendly city that shows itself, especially in these circumstances. Whenever we have folks that are affected by whether it's a natural or man-made disaster. We've had tornadoes, we've had things like that. We see our people come together. It's incredible.
It is.
So, Dr. Knowles, tell me a little bit more about how COVID-19, how this coronavirus has affected what campus life.
Sure. Yeah, it's been pretty drastic for us. We're very fortunate. Several years ago, we invested a lot into our infrastructure, our technology. We're a gig campus. We built out a platform so we can do a lot of our classes online. And we've been teaching and working with our faculty to learn how to do that more and more, and to take advantage of the promise that all that technology brings to the learning environment. And we've had a bunch of folks who are really masterful that have been a part of that, and including Dr. Grant Wilhite. And so our faculty have been doing more and more of this. And so when we came back from spring break, which was in the first week of March, was a little bit earlier than some schools, which made it a little easier, frankly, because our students came back before the big wave of the pandemic moved across the country. And so our students got back to campus. We got back into sessions, and we decided to take 2 days off and let our faculty move to online, because we could see that it was the right thing to do to make sure everyone was safe. And then, so right around the 18th of March, we went online. And we've been online ever since. So we have 1,100 students scattered around this region, but particularly around the United States and other countries, who are basically conferencing in with our faculty daily, usually in the same schedule they had before, and learning very much the same way, using Zoom and Microsoft Teams and other technologies to conference with students. And then we have a care team that's following up regularly with students, making sure that they're making progress if they're having difficulty. Again, we do have some students who really call Athens their home and are going to stay right here, or they're from another country and concerned they couldn't get back if they left.
Sure.
So they're here, and you'll see them around town, etc. And they seem to all be doing great. Everybody's doing wonderful. Our staff and faculty are working remotely, like most of us. And so we have a skeletal staff physical plant people taking care of our campus, and security and some other things, food service people on campus. But generally the campus is quite barren right now. But it's beautiful nevertheless. So we're anxious to have students back, no question. So the big task for us is really working on getting ready for the fall. And so we are preparing like they're going to return in August. Our graduation, while it's not May 9th, like we had planned, we're moving it to August 7th at 7 p.m. And we're planning for that. And then we're planning for if there's another wave or something else. We're just working through every contingency we can consider because we want our students to keep learning. And the other thing I would just mention, there's a lot of evidence that a fair number of you folks who are seniors in high school are maybe considering staying a little closer to home until this thing subsides. And we just want to reach out our arms and encourage you to consider Tennessee Wesleyan in a part-time or online. We get a variety of different ways we can serve you. If you're perhaps you weren't originally intending to go to Tennessee Wesleyan, we want to help you in that transition, and then you can transition to whatever institution that you'd like. But we'd love to serve those folks. And of course, we get a lot of folks from the local area come to our university as well. So.
We certainly do, and we're happy to see that. I know my children are 7, and you mentioned campus, and it is barren right now, but beautiful. Mm-hmm. It is gorgeous. We love taking walks. We'll walk our dog and go through the neighborhood, and they wanted to go see Tennessee Wesleyan a couple weeks ago, and so we went on a walk, and the only people there, we did see security sitting off to the side and keeping a check on things, but we took a walk and went and saw the statues there with Nakatula, and just a beautiful, incredible campus. Your staff's doing an incredible job at just really making sure that is a highlight in downtown Athens. And I know from the city perspective, we're very thankful to have you here, and how much you care shows. And that your campus is largely open to the community to use. Yeah.
Well, I've said this many times, we're kind of all in this together, not just this situation, but the success of our community is really something we all have to take responsibility for. And the university is critical to the city, and the city's really critical to us. If we're going to invite people from all over the world to come and be with us for 4 or 5 years, or to come do their career at Tennessee Wesleyan, we got to create a really vibrant educational, cultural, economic, thriving community here. And I think we're well on our way, and we want to help lead and be a part of that in every aspect. One thing that I brag about all the time is the economic development or the economic impact on this community from this university. And it's not because of me. It has to do with all kinds of wonderful folks, including our staff and faculty and our students. But we're responsible for roughly $68 million worth of economic development every year. And we're really proud of that and glad to do it. And we want to expand even more. We had the best enrollment year we've had in the history of the university this past year.
Congratulations.
And a lot of new programs, a lot of new initiatives, and very proud of that. But it has to do with how the city is getting stronger and better and more vital. And every little improvement we make adds up, and people want to be a part of that success. And they want to move here and bring their families, and etc. And we're riding that wave as we all work together.
There's been a lot of wonderful partnerships between the university and the city in recent years. With there's construction on College Street that looks like it's getting close to complete.
It is done. We just finished.
There'll be a big celebration at some point when we're allowed to do that. To open that sector of College Street there, right in front of Sherman Hall.
We're calling that University Square.
University Square.
And we're really thankful to the city to let us do that. I think to some it might be a little bit of an imposition because folks used to cut across there. But for the safety of our students, and it just creates another venue for the community to use, including the city, for a pumpkin town, Christmas events, whatever we do. We really want the university to use that section, and it's a little bit safer. And we've done a fair amount of construction there. Very proud of it.
Very good. One of the other things that you mentioned thriving, and I know we've been good partners with Main Street Athens, and we've had Lisa Dotson on the update to talk about Main Street and COVID's effect there. But the Lighthouse, and it's we used it even with the City Council coming to our strategic summit, which we do annually. Historically, it's been out at the Red Brick House out at Regional Park, so we need to get into downtown Athens.
Terrific. Good.
We've got high-speed internet, we've got a beautiful space, and we got in there and used it, and I think if we can, we'll be back annually, because that was so popular with our City Council. But talk a little bit more about that Entrepreneur Center and how it came about, and the strong partnerships that really led to, I think we can see some early success coming out of it now.
Well, I think it's a real example of when the county and the city and the university and other entities come together, we can do amazing things. And we've needed something like this, where entrepreneurs who have a dream want to light that flame and start that dream, but don't know necessarily the first steps. And so a bunch of us have been talking about it for a while, and thanks to the Mayfield family, who gave us some space to use for a couple of years, and then we were very fortunate, thanks to you, Seth, and John Gentry, and several other people, we were able to get some grants and help underwrite that, so it wasn't university money. And then we've involved our students and our good friend School of Business as well. And so our faculty are involved. We do pitch competitions. We do a variety of courses and workshops for people with regard to insurance and accounting and marketing and all aspects of launching a business, putting a business plan together. It's a great resource for people, and very low cost. And you can rent a cubicle. There are cubicles in there. Low cost option. So if you don't want to work out of your basement, you can start your business there, and then be with other entrepreneurs. Really create an ecosystem of innovation and creativity, so that they can make their dreams come true. And again, it was just a handful of us. We went and looked at what Chattanooga was doing one Christmas. We came back. We said we got to do this for our community, and we all held hands and made it happen. So. It's a great example of how working together makes a big difference.
Absolutely. We love to see that togetherness. You mentioned graduation. Now it's been pushed out to August, and so folks can plan ahead for that. And the university's already looking ahead. What if we see another surge in COVID positive persons? If there's a maybe, and I'm not really wanting to call it a relapse, because there are no vaccines. There's not necessarily a treatment. There's some thought out there about what's the term, James? Herd
immunity.
Yeah. Herd immunity and inoculation and things like that. That we're going to let the doctors, the epidemiologists, the folks that special in that research that and get back to us before someone like myself goes on trying to talk about it. But all that to say that I know we've got sports that have been affected at the university and all levels. Graduation being put off. You were able to fortunately move to an online model to continue classes.
And we'll continue that right through the summer. About 70% of our offerings in the summer, which are a lower cost, frankly, than the traditional or the typical fall and spring. But that's all available for the community to take one class, take whatever, and can register for those classes as well. Or if somebody's back for the summer from UT or any other institution and need to pick up a few classes, it's a good option. And then again, all online this summer, and a good menu of options for folks. So that we're doing. And then in the fall, we're doing like a lot of universities are doing, some contingency planning, where we are taking all the courses that we typically do in person or in sometimes what we call in seat, and building out a framework to be able to do those online as well. So one of the real bright, the silver linings of this whole situation is it's really forced us to use technology more and to build a platform for students to learn in a little bit different way. It's sometimes called a flipped classroom, and where you're doing less lecture and all of that, and more reading and more discussion, and much more discussion oriented, and the format kind of requires that to a degree, because most of our courses are synchronous, but we are going to do some asynchronous as well. So it just allows us to use all the promise of technology to enhance learning, and we're thrilled to be able to do that. I wish it weren't really in this situation, obviously, because people are out there hurting, and there's some illness, and that's worrisome, obviously. But we're ready to go, and be ready to go in the fall. There's always a chance we start, and then we have to go online for a period of time, and then we're back. We're also exploring always, like all schools, frankly, of starting perhaps a little bit later if we have to, just to give us a little bit more time. So we'll do whatever is necessary to make sure our employees and, of course, our students are safe. And we're just not going to take any risk, because they're just too important to us, frankly.
So not only taking care of the coursework on time, but there's a wonderful tradition of giving back at Tennessee Wesleyan University. And I know you have a food pantry that you've kept going through the pandemic, and you're using to help out. Would you like to talk about that?
Sure. Well, 2 days a week we hand out food, as well as we do back sacks for the kids, for the school kids. And that was all started by students several years ago. To be honest, I questioned whether it was really something we needed to be doing, of all the things we needed to do. And our students were adamant. They said, we got to do this. It's part of the DNA of this place. And I caught on real quickly, and we got behind it. And thanks to the Athens Federal Foundation and a number of other entities, have really made it happen. And it's proven to be really critical during these difficult times when kids need food because they're not getting it from the schools. And then we have a number of families who rely on us twice a week to come in and pick from our shelves on our campus where we have the food pantry set up, along with all the other churches and entities around the community. And we're proud to be able to do that. And frankly, it's good for our students to be giving back. That's something we all need to be about, certainly. And in many ways, they lead the charge. Our students do a tremendous amount of service. If anybody's ever worried about whether students are not going to lead and serve this world when they graduate from college, I will tell you, it's a real movement. It's part of who they are, and they roll up their sleeves, and they love the fulfillment that comes from loving your neighbor, and that's what we all got to be about.
Absolutely, wholeheartedly. Well, Dr. Knowles, I deeply appreciate you being able to be with us today.
It's a pleasure.
Is there anything else on your heart, any message that you would like to share with anybody watching?
I always like to brag a little bit. If I could just have 1 minute, we're launching some new stuff that I'm really excited about. One is a Master's in Arts and Teaching for anybody out there who wants to be a teacher, who perhaps got a math degree or have some other kind of particularly STEM degree and want to get in the classroom. We're offering special masters that will help you get licensure and a fast track into the classroom. So it's a little bit different than what people are familiar with. The other thing that I'm excited about is we moved our dental hygiene program from Hiwassee College, and we moved it. It's now on White Street in what is called Miller Hall. So if folks drive down White Street and see this building called Miller Hall, it used to be called McSpadden's Furniture. Mitch Miller, our landlord there, helped do the renovations. It is fantastic. And we're renting space there. And again, just continued expansion to try to improve the community, bring more people here to shop and enjoy and be a part of this really wonderful community. And we're proud to be a part of that, and we'll keep looking for those kind of opportunities.
I love that. And you've been such a good partner to Athens, and I think the tremendous growth of the university in the last few years with the addition of the Column Center, now the dental hygiene program, the Lighthouse, making sure that you have a complete campus. You're not separated by a high traffic road. A lot of great movement bringing those people here into our community that are from outside of the community, and keeping folks that want to get all the way up through master's degrees without leaving home. They can do it right here in Athens.
Right. Yeah.
Incredible. Thank you for your partnership.
You're welcome. It's a pleasure. I'd shake your hand, but we don't do that anymore.
I know. And I'm not a fan of the chicken wing thing. Maybe we'll kick each other's shoes.
Yeah, we're going to come up with some new.
There's got to be
some new conventions. We'll come up with some new things.
Just an air fist bump or something.
Yeah, there you go.
So I do have a few other announcements as we wrap up today. We did learn today from Governor Bill Lee that Friday he is going to allow May 1st that elective medical procedures can now resume starting this Friday, and that does include routine screenings and things of that nature. So he's focusing on trying to get, which was really, it just kind of caught me off guard when I noticed that healthcare workers were being furloughed during a pandemic. We knew we needed nurses, but other healthcare workers that were perhaps even laid off during a pandemic struck me as odd. But this will help get those nurses and hospital workers, healthcare workers back on the job starting Friday under certain guidelines. And you can find all this information on tn.gov. We're just reporting our state's movements to our people and giving a local touch about how it's affected us locally. McMinn is, as we've announced, is one of 89 counties out of the 95 across Tennessee that falls directly under the governor's orders and the governor's guidelines. So whatever the governor is putting out under his emergency powers, McMinn County, Athens, and all 89 other counties are under that jurisdiction. The other 6 counties, the governor gave special authority to their county health department to set those reopening guidelines for those county businesses. So in places like Knox County, Hamilton County, Davidson County, Shelby County, Johnson County, I almost rattled all of them off. So there are 6 of those counties that the health department itself has jurisdiction over the cities and the county itself, and how those businesses and when those businesses will reopen. McMinn County, City of Athens, everybody touching us is part of those 89 other counties that fall directly under the governor's emergency powers and his executive orders and authority. And so we are responding and reporting back to you, and you saw that yesterday with the graphic that was created by our Athens Economic Recovery Team. And that's been shared across social media. Keep sharing that. That's just a local touch to what the state is saying, businesses that may begin opening up. And I stress that may. The governor's not saying you have to open up. The governor's not saying you will open up. The governor says you can open up under these guidelines if you want at this time. We found out this past Monday, in all 89 counties that are under this mandate, their restaurants can begin opening back up if they wish, and several are not. They do realize that these guidelines may be restrictive on how they conduct training, how they're able to serve their customers. And so I drove around town today. I did notice several popular restaurants that are open, but they're opening still only for drive-through or curbside. They're not opening their dining room yet. If you own a restaurant and you want to open a dining room, then there are guidelines in place that allow you to do so right now. Retail opens tomorrow. There are guidelines that give how you may do that if you wish. If you're a small business owner, if you're a retailer, you may open up as soon as tomorrow under these guidelines and taking all of these certain precautions. Those are all on tn.gov, and you can see a basic set of those right here on our page, just a couple posts below this video, where we have that graphic and you can share that. That's just an Athenian touch to what our governor has declared for us. So we also understand that plans are developing right now for other industries and other sectors of our economy. We've talked about barbershops, salons, tattoo parlors, places of a more physical touch nature that were all outlined early on by the governor as in order to close, remain closed until further notice. And the governor is working on the guidelines, and his team are going to roll those out in the days ahead. So please stay tuned for that. I know a lot of people are anxious and waiting to hear what that is. And there will be allowing some of our industries, some of our local manufacturers that have furloughed, that have had to close down certain lines. They are going to be allowed to begin reopening those lines, reopening their facilities and getting folks back to work on a phased-in, slow approach. For the city of Athens, I want to talk to you a second just about Friendly City here. As far as our approach to protecting the public health and our employees' health, you're not going to see changes immediately. You're not going to see changes fast in the way that we are conducting business. We're going to continue to conduct business electronically when and where we can. We're going to otherwise set appointments for the public to be able to come in and do business with the city. So call us, 744-2700, if we can be of service to you. And we'll do everything we can electronically from distance to make sure that we're not coming in contact with each other. And for those things that we have to be person to person, we will maintain our social distancing. We have now shared gloves, face masks with our staff to make sure that they are comfortable in protecting their health and the health of our citizens as we continue being at work for you. Playgrounds will continue to be closed until the foreseeable future. Our parks remain open, but then sports remain closed. Those close contact groups of 10 or more are still not going to be allowed under the guidelines. And so just keep watching with us as those things may change, and we do hope they change in the weeks ahead. There are no plans to change those until we make sure that this pandemic has a lid on it, that things are that sufficiently being throttled back here as far as the spread of COVID-19 for us to feel safe that your health is protected and you can use those playgrounds. You can get out there and start playing certain sports again. And so just want to update you on Friendly City. Not much is looking to change in the near future as far as how we're conducting business, what's open, what's closed, those kind of things, what we're allowing right now as far as our parks, our fire, police departments, community development, public works, sanitation. Everybody is still right here working for you, taking care of business to make sure that when those essential workers, that you've got everything you need being taken care of, and those other folks that are looking to get back to work as you're able to, that we're here, that we're taking care of you at home and at work so that you can do what you need to do for your livelihood and for your own health. And I'll wrap up today with a thank you, with several thank yous actually. Today I talked to our local Walmart manager, and we're looking at making sure that he's been right on top of it, making sure that they're taking care of one-way traffic through the store. They've started requiring all of their folks to wear face masks. But more than that, for our first responders and for our employees here at the city, to make sure that we can keep doing the business that our public requires of us and needs from us, they're offering to help with covering face masks, sanitizer, things of that nature to keep us running. So thank you, Walmart. Mid-Lab was early on. They have certain cleaners. Mid-Lab is one of our local manufacturers here in the city of Athens. And they have certain cleaners that are proven to kill COVID and COVID-related viruses. And we were able to get with them early on and get some of those cleaning supplies and make sure that we can take care of public spaces here at the city throughout our campuses. Today, I'll show you a little example. Now this is produced by Denso. Denso is our largest employer in McMinn County, and right here in the city of Athens. This was made at their Maryville facility, but they were able to transport some of these face masks here and wanted to make sure that these got into the hands of our first responders. So we had 70 of these face masks donated today from Denso, and thank you to Aaron Holbrook and the team out there at Denso for making this happen on a moment's notice. These were on a news channel yesterday, I believe, and so we were able to touch base, and they provided us with these face masks that I believe are 3D printed. I think this portion is 3D printed. Got them boxed up, sanitized, and delivered to firefighters and our police officers today. So thank you, Denso. That is important that we see these type of masks, because one of the most vulnerable areas that we have for folks that are not wearing eyeglasses or eye protection are actually our eyes. And so droplets coming in contact with our eyes is another way to transmit COVID-19 and many other illnesses. And so this is really going to come in handy as we're able to cover our eyes, nose, and mouth. And of course then just a simple cloth surgical mask, a cloth covering of some sort over your nose and mouth to help prevent you from shedding droplets that could be left walking down an aisle or on a countertop, and maybe even a few hours later somebody come by and touch that, and there we have shared COVID. It's not what we want. So you're using this to protect your and other people's health. But those are some good items, and big thank yous to our local folks and many others. These are some good ways that we're making sure that we're protecting the public health and our first responders. But more than that, we have so many great Athenians out there that have started making their own, making face masks and donating them from hand stitching. We've got a lot of folks doing things like that. Donating hand sanitizer. I know a case of hand sanitizer showed up at the fire department over the weekend, and we're very thankful and grateful for those. Folks have been going out of their way to feed some of our first responders as well. Lots of pizza and donuts and things like that, and we're always deeply appreciative for how well our community comes out to support each other in times of need, and make sure that those essential workers that are on the front line, that have to respond at a moment's notice and don't know what they're walking into, that they're being taken care of. Yeah. So a big thank you to our Athenians, to McMinn Countyans, and to our local industries that are going above and beyond to take care of our neighbors. Thank you. With that, look forward to being back with you tomorrow on the Daily Update. We'll go over our Tennessee Department of Health information, and we'll also have Dr. Melanie Miller with Athens City Schools to tell us another update about where our city school system is right now with their response and how they're having to change things with COVID-19, and then looking into the future. What does that look like over summer and maybe even into fall with our pre-K through 8th grade students here in the city of Athens? So tune in to hear more about our Athens City School System from Dr. Melanie Miller tomorrow. May God bless you, and may God bless Athens.